Hello guys! If you have ED, that's certainly not a good thing, is it? But did you know there could be a bunch of reasons why it's happening? Yeah, as if ED isn't already a bummer, right? Well, let's talk about it with Dr. Jim Sears. So Doc, what's up with that?
Thanks, Ashley. Okay, let's talk about it. You're right, erectile dysfunction can be more than the obvious problem. The fact is, it's important that men know more about ED and why it's caused and why a man's overall general health is closely associated with their sexual health. What many don't know is that there's a very strong link between erectile dysfunction and a greater risk of having heart disease. In one study, 57% of men who had heart bypass surgery and 64% of men hospitalized for a heart attack had at least at one point had ED. Having ED can predict that a man will probably have heart disease symptoms within 5 years. In fact, having ED is as much a risk factor for heart disease as a history of smoking or a family history of coronary artery disease.
What diseases commonly cause ED?
Well, there are vascular diseases which affect the blood vessels. These diseases include atherosclerosis, which is hardening of the arteries, hypertension, high blood pressure, and high cholesterol. These diseases, which account for 70% of physical-related causes of ED, they restrict blood flow to the heart, the brain, and in the case of ED, to the penis. Atherosclerosis alone accounts for 50 to 60% of ED cases in men over age 60. Diabetes, which can cause nerve and artery damage that can make achieving an erection difficult. Now, between 35% and 50% of men with diabetes will experience ED. Kidney disease, which can cause chemical changes that affect hormones, circulation, nerve function, and energy level. These changes can lower libido, your sex drive, or sexual ability. Drugs used to treat kidney disease can also cause ED. Neurological, which are nerve and brain diseases. The nervous system plays a vital part in achieving and maintaining erection. It's common for men with conditions such as stroke, MS, Alzheimer's, Parkinson's, and spinal cord injuries to experience ED. This is due to an interruption in the transmission of nerve impulses between the brain and the penis.
I've heard that men's prostate issues can affect their overall sexual performance.
Yes, prostate cancer, which doesn't cause ED on its own, but treatment for prostate cancer can lead to erectile problems. So, be mindful if you're experiencing erectile dysfunction, there could be a very serious reason for it. A problem behind the problem, you might say. That's why it's important that a good diagnosis takes into account medical history as well as results from testing.
It's to my understanding that many men are skeptical, even embarrassed to seek help.
Yes, it's true, but after men see how well treatment programs work, they tend to lose all skepticism. Men, do your research, but don't wait to diagnose a problem that could have even greater health implications. I'm sure your wife or loved one will appreciate you taking the initiative too.
Thanks, Dr. Sears.